Welcome to Healthcare IT Today. I'm John Lynn, together with my colleague and friend Colin Hung. The world of technology and healthcare are ever changing in new and novel ways, and that's why we love this stuff. So join us as we discuss the latest healthcare and health IT news, meshed together in new ways which help generate ideas and new perspectives. Plus, we'll have a little fun along the way. Today, we're going to be doing a little preview of the ViVE and HIMSS conferences. And be sure to follow the show on social media at the hashtag HITSM and our personal accounts at TechGuy and at Colin_Hung. Plus, check out our 20 years of health IT content at healthcareittoday.com. How many ViVEs and HIMSS have we been at? I think
A lot.
let's see, 16 HIMSS, I think. And how many ViVEs have there been? 5, I think.
Yeah, I
So,
think I've been at every vibe that there ever was, but
yeah, me too.
yeah, hymns, I think this is probably my 16th or 17th hymns.
Yeah.
Yeah.
I think it's
So,
16 for me. It would be my 16th, I think. So that
yeah,
would
so I'm
be
probably on the same
21
number.
conference. So we have a little knowledge about the event. So.
There you go. We've been there enough times. We've been tells you how old, right? We were there when it was held in cities that you'd never heard of, that you never imagined it being held there, right? Like,
Yeah, my first one was in Atlanta. My
yeah,
first HIMSS.
exactly.
It's like
I
it's
remember the
not big
Atlanta
enough now.
one, New Orleans, Atlanta, right?
Oh
Like,
yeah, New Orleans was awesome. Although I've realized, when I went to, I think it was CES recently, I've been in the Venetian Sands, whatever you want to call it these days. It's called Venetian. I think I've been to 100 events there, which is, I mean, I live in Vegas, so it's a little biased, but it's crazy.
well, yes, this is going to be our fun preview of HIMSS and ViVE, ViVE being, of course, up first. I think the question that a lot of people have for us, John, is what's the difference between those two conferences? And would you pick one versus the other, or do you go to both? What do you think?
I mean, the vibe is definitely different. That's clear. Vibe has definitely a kind of an edgy, kind of upscale, they got the DJ in the hallway, which Hims has done as well, right? But it just has that energy and feel that that they trademarked, I think, in HLTH and probably the other events that the founder did as well, right? Created that kind of vibe and feel. HIMSS has stepped up in a lot of different ways, especially since selling off the conference to a conference organizer. They've done a number of things as well. I'd say the big difference for me though is the type of attendee and in some ways the content that's there. I think Vive is much more of an executive level CIO and CIO leader, IT leader at hospitals and health systems. They're both trying to get into payers, and I think neither one has fully cracked that. There's a fair number of payers, especially payviders that are there, but I think they're both trying to push into that one. So that there's some of those payers, but still executive level at Vive. Whereas HIMSS, to me, embraces kind of every IT professional. So you get a lot more of the IT infrastructure leaders or the analytics people, the informatics people, those types of people at HIMSS, which you don't find them at Vive. I mean, Chime is working to embrace them. They just came out with a new framework to kind of embrace 3 levels of professionals within healthcare technology and people versus organizations. So it's interesting to see how Chime's expanding, and Vive will probably reflect that same expansion eventually. But yeah, right now, it's more about CIO versus others. And I'd say HIMSS has a greater depth of vendors versus Vive, which makes sense because if you have the CIO leader, the CIO maybe doesn't buy the security system or some of the infrastructure that they would, they kind of leave that up to their CISO or to their, director of IT infrastructure or whatever it might be. So, you get a different one. And same is true, you'll have more consultants at Vive because the CIO is the buyer of consulting services, whereas at HIMSS, maybe not. I mean, most of them are around there as well. And to be fair, HIMSS has a fair number of CIOs that still go. So to answer your other question, though, do you pick one versus the other? Of course, we don't. We love both. But for others, I'd say, are you more of a leader? Then Vive fits better. If you're more of a maybe someone else that's doing more of the work, the EHR person, etc., where you need to see a bunch of vendors. I think HIMSS is slightly better for that as well. If you need to see like 30 vendor partners that you have, then that's probably a better fit. I see a lot of CIOs that want to go to both. It's just problematic because they're like 2.5, 3 weeks apart. So yeah, that's tough to say, hey, I'll be gone twice.
Yeah, I mean, first of all, I feel for vendors because I think as a vendor, you have to be at both. I don't think there's really, I don't, it's so hard to choose one versus the other. Now, maybe you don't exhibit at both. Maybe you're an exhibitor at one and attendee at the other, and or maybe you're an exhibitor at ViVE and an attendee at HIMSS, or the other way around, right? I do think you have to be at both because the audience is so different, but also the organizations, they do have to choose between the two, right? It's very difficult to go to both. So one may decide, oh, this is my HIMSS year, and the other one may decide this is my ViVE year, right? So if you want to hit both of them, you have to go to both. So I feel for vendors because I think that is the answer. You have to go be at both of them.
Mm.
But as a provider, I agree with you. I think in general, HIMSS is more broad and has more for people who are not the CIO, right? It has, a whole thing around security. It has a whole thing around interop. It has, if you're looking for solutions in a lot of different areas, you'll see whole areas of HIMSS floor where those people are, right? And you're bound to find somebody in those areas. So I think it's more of a place where if you're looking for solutions, that's where you go. If you're looking to connect with somebody you're already using, they're more likely to be at um, HIMSS than ViVE. But
Mm.
if you're looking for more general, the trends, if you're looking for kind of what's happening in the industry, then as a provider, maybe ViVE is a little bit better in that sense because it's more tuned for you as a CIO. There's more of that there for you. So it's also got, as you said, it's a bit more of a higher production quality if that's you're looking for something different. Um, but I see the two audiences being very different. So I unfortunately, I think I'm in the camp of you got to go to both of them.
Yeah, I see from a vendor perspective, two camps. One is there's some categories where they just have to go to both, you're right. And there's a decent number of vendors in that space. But I see some of the vendors, they're like, so, like when it comes to RCM, security, infrastructure, like some of them are saying, wait a minute, do I need to go to both? Is my buyer really there? So I don't know. I'm seeing some of them being a little more discriminating in what they want to go to. And it may be a budget reality, right?
Yeah,
Hey, we'd love to go to both, but we don't have the budget to go to both. So how are we going to approach it? So that would be interesting. From a
that's true.
content perspective, it's interesting because HIMSS has this long process of curating and submission, and you have committees that review it all, and definitely a bias towards users. They don't want vendors on stage. They don't, so from a content perspective, it's a very different approach, and it's submitted 9 months ahead and those types of things. Whereas ViVE, I would describe as more of a curated. They want to curate the speakers, and there's a call for speakers, but you submit yourself, not the topic. So they want to kind of curate the content using their experts, that are part of it that we've had on the show a few times as well. But they want to curate having competitors on stage and creating some discussion and not conflict per se, but like differing viewpoints on stage at the same time. So from a content perspective, it's quite different as well.
Yeah. Well, let's move on to some of the stuff it's going to happen at the show, John. Like what do you predict, or what are you hoping maybe, or what do you think we're going to be talking about in the hallways at ViVE and HIMSS? Like, what's that water cooler discussion topic going to be?
I'm pretty sure that no one's going to talk about AI at all. Like it's going to just be
We're past it. We're done with it. It's over.
they're like, we're sick of AI. Although ironically, I predict that at least some healthcare leader will come up to me at like a party or in the hallway or something and be like, John, I think this AI is overblown. I think it's all hype. Not there's not a lot of substance there. Like I'm confident someone's gonna come and say, hey John, I see the potential of AI, but it is not there. So I think there will be some of that. But probably I actually think even more than AI to some degree, although AI is going to be an overtone of everything,
Hmm.
is going to be what health systems are facing as far as budget constraints, as far as hiring good staff, the expensive staff, and things like that. I think that, in this kind of uncertain market that we're in, and what is the policy going to bring, and what does it mean that some people are falling off insurance, and how's that going to impact my organization? And I think that whole uncertainty and budget challenges and then other pressures, right? Am I going to be paid less from Medicare? What about pharma pricing? Like, how is that going to impact it if we have to, leverage it against what they're paying other countries? How is that going to impact our organization? And there's this trickle down of budget effect on IT that I think is going to be probably one of the biggest conversations at both conferences.
Yeah, hard to go against that. I think budget is going to be the top topic. I think it'll actually be bigger than AI.
Mm-hmm.
In terms of what people are going to be talking about as they go between sessions, as they walk the halls. I think people are going to be talking about budget, both in terms of the vendor side, just because their budgets are constrained, because people aren't spending or people are delaying decisions because it is uncertain, right? And they want to see how the year kind of progresses a little bit. And I think, yes, on the provider side, for sure, I think they're looking at impact on revenue and people falling off insurance and not being able to cover and not have coverage. But also just the uncertainty of Medicare, Medicaid, as you pointed out, right? And then the continuing skyrocketing costs. So yeah, I think it'll be a big topic of discussion. I don't think we're talking job losses or anything like that. That doesn't seem to be the tone I'm getting, but definitely the squeeze of, okay, let's put some projects on hold. That thing that we were thinking about doing, let's put that off. I think we're going to hear a lot of talk about that and then see some of the effects of that at both conferences.
I think you're right. We need another year before then the job losses start racking up and they start firing people and things like that, or reduction workforce, or any of that kind of thing. But what's interesting is that most of the solutions are going to be about cost reduction. So I
Right.
think that's going to be interesting. So it's still going to be an overtone, even with every AI solution that's out there, is like, hey, let us help you with that problem that you're facing. The problem is we're probably going to not see a lot of net new. It's more building on your existing companies, the relationships you have, maybe a few AI ones that you'll slip in there, when they hit just the right tone and target of what you need. But the net new is going to be the challenge, I think, from a vendor perspective. What's happening? The other one that I think is going to be a big discussion in the hallway, though, is an AI related topic, but it's not going to be, what AI should I implement in this? Like, it's going to be like, how do I know what's real and what's Memorex, right? To call back to that old commercial, right? Like, how do I know what's there and what's going to be good for the next 5 years or 10 years, right? Or which organization or which algorithm or whichever, right? Like, there's going to be so many options. I think that most of the health IT leaders and CIOs in particular are trying to get their heads around what's the governance around all of this opportunity, and how should I be approaching all of this opportunity in a way that's sustainable. And so I think there's going to be this feeling of kind of overwhelm where they're like, yeah, there is a lot of opportunity, but where do I start? And oh, by the way, I got to replace 1,000 desktops at the same time, and my network infrastructure is crumbling, and whatever else, right? Like, whatever other kind of mundane keep the lights on that they're dealing with as well, let alone retention of staff, and hey, they can get paid more somewhere else, and all of that. So I think that's the kind of overwhelming feeling, is my guess of what we're going to hear from a lot of CIOs out there.
I'll just throw one more thing that I think we're going to hear about. I think we're going to hear a lot of talk about regulations, policies, stuff coming out of Washington. There's been a lot of changes, and I'm not talking about any of the stuff happening with the FDA. I'm just in general, like in terms of the uncertainty around CMS funding, Medicare, Medicaid, the whole telehealth exceptions, like all those things that, they're ended, what it's going to happen. And I think also some of the other things that are coming down the pipe that are continuing, like the interoperability, the info blocking. I think that's going to be another another year of that being a hot hallway discussion point.
Yep, totally agree.
Okay. Hey, if you're just tuning in, you're listening to Healthcare IT Today with John Lynn and Colin Hahn. Today we're previewing our ViVE and HIMSS attendance. Now at ViVE, John and I will be in the Media Village doing paid and earned interviews. You can find us there. At HIMSS, we will have our big booth in the back corner of the exhibit hall where we will have our on-site interview studios. Come visit us at booth 6453. And if you're looking to showcase your thought leadership, build brand awareness, or tell an important customer or product story at either of these two conferences, you may want to consider one of our interview packages. You can learn more by going to healthcareittoday.com. John, what are the topics that you're most interested in covering at ViVE and HIMSS?
It's a tough question to answer. I mean, I was just pondering as you described our participation in the videos and studios. I think we did 150 videos last year, somewhere in that neighborhood. So it's
Just
like
bonkers how many we did.
that's a lot of stories that we're telling, right? So, yeah, I don't know. I mean, your government one is going to be really interesting, and coming out of JPM, it was amazing to hear how many government people went to JPM, which is not usual. So I have a feeling we're going to have that same representation at ViVE and HIMSS,
Mm.
with them, chopping it up. It kind of makes sense, right? Trump and Dr. Oz love media. They love you getting out there and talking it. So I think we're going to have a similar kind of representation and lots of conversation there. Some other ones that I'm interested in. I am interested in the infrastructure topics.
Mm.
That's my tech guy background, probably they calling out, but it's amazing how companies like Connection are so important to an organization, whether it's buying keyboards and mice and peripherals and things like that, or even the bigger companies. HP is there, Dell's there, the big companies, CDW, even Vizient doing negotiations. Like that is such a big part of people's budget that I'm interested to see what are the conversations happening with them. And my guess is that most of these health systems are going back to them and saying, "Hey, I need to carve up my budget a little bit. How can we be creative?" Right. And so I think that's going to be really interesting to see. Another one that's interesting is the interoperability side of things. LK has gone all in there, Rhapsody, and we have this kind of like interface engine and interoperability and data archive. But then on the other side, you have the e-health exchanges and Commonwealths and Sequoia project and doing exchange, and how do all of those meet? I mean, we certainly get those conversations. I mean, ASTP conference is coming up, so there'll be some of that, but it happens in a big way and in really interesting ways because you have the vendors there at ViVE and HIMSS. So having all of them there, Direct Trust is there, I know as well, talking about it. Although of course they have expanded in a big way to even certifications and things like that. So and that hits maybe a third one that I'd throw in is identity. Direct Trust deals with a lot of identity management. ID Me and Clear, they're going to be at there, and they're kind of the forerunners of identity management, especially from the CMS, health tech ecosystem, I think is what it's called, right? And so that's going to be interesting. Like, what progress are they making? Who are they partnering with? Who else is? I'm guessing that we're going to have dozens of partnerships between the two of them announced between ViVE and HIMSS. So that'll be fun to see and see it play out. But even companies like Imprivata, like what are they doing in the identity management space? They've done all the biometrics and things like that with easy access. How are they, evolving and playing in that identity management? So there's three to start. What about you?
I think those are very deep and I love them. I mean, it's typical you, right? Like those areas. So, I mean, for me, I'm very interested this year in the RCM space, revenue cycle space, because I just think there's such a focus being put on it this year, similar to last year, right? Where just revenue is king. Anything we can do to speed this up, make it easier, get more out of that, I think is hot. So I'm gonna be spending some time checking that out. And lots of companies there, right? Like RevSpring and Wavestar, Codametrics, FinThrive, Optum is back, right? So I'm interested in seeing that. For me, that's a space I'm going to be spending some time in, kind of figuring out what's going on there. I mean, we all know AI plays a big part in that space now, but now that we're past that, what else is next? Like, what else is happening? You know, that's one for me. Another classic for me, of course, digital front door, patient experience.
Your
There isn't a
favorite.
lot of presence in that from the vendor side at HIMSS this year. I think a lot of them are going to be going, but not a lot of vendors are exhibiting. There are, there's Firely, there's Artera, of course, Ring Central, those kinds of companies interested in seeing what they're doing to continue to push forward on patient experience and digital front door. And then, for me, partially because I have a soft spot for it, but seeing a lot of radiology vendors now show up at HIMSS, right? We've got Philips, we've got Ramsoft, we've got people that normally go to RSNA are now kind of going to HIMSS because, radiology continues to be such an important part. But also, there's a lot of really cool tech that maybe could be applied in other areas. So I'm interested in checking out what those guys are doing, Highland. But then, you know, there's lots of other companies that I'm just interested to see what they're up to. They're like our friends that we normally
Yeah.
see at HIMSS.
Yeah, it is interesting. Like ADOC's in there as well, right? And they just, got an FDA approval for some of the efforts they're doing. It is interesting how that overlaps with health IT and informatics. There is this kind of weird overlap that, you need the buy-in, right? If the CIO doesn't trust it, if the CISO doesn't trust what you're doing in radiology, guess what? Your radiologist can love it as much as they want, but the CIO could ruin your deal. So it makes sense why they want to be there and have those conversations. I'm going to be interested to see, and this is more of a category, but like, who are the AI supporting companies?
Mm.
So, like, they always say in the gold rush, you want to be the person selling the shovels. I kind of want to know who's selling the shovels to, do AI. In some ways, Intelligent is in that category to some degree. Although they have some of their own products as well, but they're providing a service to a lot of people to be able to accelerate what they're doing, right? And I wonder how many others there are out there that are going to do some of that AI supporting stuff. It'll be interesting to see. Are OpenAI going to be there? And because they're kind of in that same boat. Same with Anthropic. Of course, AWS and Microsoft. They're in that category as well. Of course, they have plenty of other things as well, but they are in that kind of AI supporting role. And it's like, okay, how many of those companies are going to be there that help you get where you need to go? Here's another one that is going to be fascinating to watch. I'm interested to see how the consulting companies show up. There's been a lot of questions with the deep dive Gen AI. Do I need the consulting companies? I think the answer is yes, but I think they're going to show up in a different way. So, what Guidehouse and KPMG and Accenture, like all of those companies, how they show up and represent and how they're looking to assist, it's going to be fascinating to see how the Gen AI revolution, if you will, has kind of impacted their messaging.
I love it, John. I love it. We're definitely going to be super busy at these two conferences. Maybe to end off, let me ask you this one, John. What tips do you have for surviving and thriving both at ViVE and at HIMSS?
Well, I'd start off with Colin needs to wear heels because I hear heels are the best way to enjoy a conference. Yeah, obviously those are the common answers, right? Wear comfortable shoes that are well worn. We see a trend like people are wearing sneakers, right? They're like, hey, this
Yep.
doesn't match my suit, but guess what? I'm going to be comfortable. I want to enjoy this, and I don't want to ruin my feet. Which I guess at a healthcare thing may be appropriate to do wellness, right? Drink a lot of water, they always say. I think that's true for LA and Vegas that are pretty dry and it'd be warmer for sure. So those are obviously the most obvious ones. But to me, it's going to be interesting. LA was an interesting choice. There was a lot of interesting reaction from people. It's not the nicest area, right? It's a little sketchier downtown, and we heard that from a lot of people last time that ViVE was there, and I think we'll hear it again. They did move the food closer for those that are worried about it and that hike that they had last year. They moved it closer, so that's going to be good. HIMSS has opened up a lot of food options. So, the dungeon, as I call it in the in the Venetian, the downstairs, is going to have some food and food options there. I think you can even buy like an all you can eat or something like that, which is interesting. So they've expanded that from a logistics standpoint. But of course, the Venetian, my favorite is go up to St. Mark's Square, go to Canaletto, have some Italian food. It's actually reasonably priced. Or here's another secret one. If you want to save some money, and you maybe you're a startup, you don't have the stipend from your organization to spend. There is a food court within the Venetian. You can go to the food court, get a slice, get some Panda Express. It's definitely less expensive. You can save some money. You don't have to wait in as long a lines too. So there's another little Venetian secret.
Love it. Love it. Yes, definitely with you on the whole comfortable shoes thing for both of those conferences because they're giant show floors. My tip is, a big one, make sure you look at the agenda, make sure you look at the exhibitor list because there's no way you're going to see it all. So get targeting, figure out what the sessions are that you want to go to. If you're a vendor, I would do the same thing. Look at the sessions and see, is this a session where it's going to attract a lot of my potential audience? And maybe you should go to that. Don't just hang out in your booth. All right. And then yeah, when you're in the exhibit hall, if you're a provider, if you're a payer and kind of looking at vendors, there's way too many for you to just wander the halls and you probably get fed up if you just did that. So be very targeted. Look at that exhibitor list. HIMSS and ViVE both do a great job at publishing these lists and you can sort and search through it. Find the few vendors that you want to meet, make the arrangement to meet them, beeline it through there, but also be open to seeing some of these other cool vendors and innovative solutions that are in that hall. Those are my kind of, tips on how to survive it. The only other one I would say, especially in Vegas, John, like your tip around saving some money, look for the ABC stores that are in and around Vegas. Like don't be spending $12 on a bottle of water. Go to the ABC store. You can buy it for $2 to $3. It's very reasonably priced, right? Get your waters and things there. And that way you're not going to be stuck with these giant bills at the end of that conference.
Yeah, for sure. Yeah, and it's interesting to see both venues it's pretty accessible, right? That's good. It'll be interesting from a attendee perspective if we see an evolution in how they're interacting. For example, each of them has now a mobile app. Will we see more and more? I think ViVE's really invested in that. I think HIMSS has as well in providing it. So there's opportunities to network within those apps. We get a lot of messages and you can find different people that are attending even and being able to network with other attendees. So I'd say check out the mobile apps. The other question, Colin, that I think everyone's asking, especially in this way, health community, our marketing community, they're like, is the purple suit gonna make an appearance? I think my salmon pants probably will at least once, at least one of the events for sure. But is the purple suit gonna make an appearance, or is there any surprises there?
I don't know if the purple suit is going to make an appearance there or whether I'm going to save that for the healthcare marketing events. But, I think you'll have to stay tuned to some of our announcements to figure if that's going to happen and if it's going to be there for the photo.
Come by the Healthcare IT Today booth and our
Exactly.
Media Village
Exactly.
at ViVE and find out.
That'll be fun. That'll be fun. Well, we're at the end of another episode. So thanks to all of you who tuned in to this episode of Healthcare IT Today. You can find more details about our show by checking out the programs page at healthcarenowradio.com. And please share your voice and engage with the community at healthcareittoday.com and on social media using the hashtag HITSM. I'm Colin Hung, along with my friend and Health IT collaborator, John Lynn. Thanks for listening. Have a great week.